Colonoscopies are a dreaded rite of passage for many adults. About 15 million are performed a year. It's been considered the best chance of catching or preventing colorectal cancer, the second most common cause of cancer death in the U.S. But a new study looks at whether the benefits of the procedure have been overstated. Published in the New England Journal of Medicine, the study found only 18% of people invited to get the procedure had a lower risk of getting colorectal cancer, but less than half of the people invited to get a colonoscopy in the study actually got one. When looking at the people in the study who got one, it reduced the risk of colorectal cancer by 31%. And get this, it cut the risk of dying by 50%. And with more on this is Dr. Anand Agarwalla, a gastroenterologist with Hartford Healthcare. Thank you so much for being here, doctor.
Hi, Stephanie. Thanks for having me.
Of course. So first of all, what are your thoughts on this study?
Yeah, well, first of all, thanks for having us. I think what I would say is ultimately, colonoscopy remains the gold standard for detecting and preventing colon cancer. As a gastroenterologist, I know firsthand that colonoscopies save lives. It's the only test that screens, prevents, detects, and treats colon cancer. This study, I think what it shows more than anything else, as you said yourself, is that colonoscopies don't do anything if you don't get them. Only about 42% of the patients who were actually invited to get a colonoscopy actually got the procedure. And when you look at the patients who actually got a colonoscopy, colon cancer was reduced the risk of colon cancer by 31%. And the risk of dying from colon cancer was reduced by half. So I think it really re-emphasizes the importance of colonoscopy as an effective test. It showed that not getting a colonoscopy is not going to help prevent colon cancer. I think what it does for us as a gastroenterologist is it reminds us the importance of really making sure that we work harder on education and awareness and trying to expand coverage. I think that there are some fundamental limitations to this study. It was done in Europe, and I think it ignores some of the unique features of the American population when it comes to colon cancer, particularly with communities of color that have much higher rates of incidence and colon cancer death. The study, it also points out the importance of having a skilled gastroenterologist do your procedure. About 25% of the gastroenterologists who did these procedures had an adenoma detection rate, which is a marker for quality, of less than 25%. The average in America is about 40%, and higher in this rate is better. I think, and ultimately, the study only followed patients for about 10 years. And the advantage of a colonoscopy is that it can prevent colon cancer years later.
All right, one question real quick, just to remind everyone, what age is it to get your colonoscopy? What is the most important age?
Yeah, it's a very excellent question. Most people will tell you the answer is 50, but actually the U.S. Preventative Services Task Force changed it to 45 for all patients unless they have a family history, in which case it might be earlier.
45, unless you have family history. That is very important. We're spreading awareness and education. Thank you so much, Dr. Anand Agarwalla, gastroenterologist with Hartford Healthcare. We appreciate it.
Thank you.